All right, so this is our presentation. It is on Florence Nightingale, and this is her environmental model. All right, so a little bit about her background. She was born in 1860 and died in 1969, so she lived to be 90 years old. Terms like the nursing process did not exist yet during her lifetime. Her theory consisted of 13 canons, some that have been disproven by advances in science and medicine, but some of them are relevant to this day, 150 years later. This is a quote by her. Health is not health is not only to be well, but to be able to use every power we have to use. I can't really see it. My screen's in the way. Um, Health is not only to be well, but to be able to use well every power we have to use. Okay. And these are her 13 theories.
Um, so for the first theory, it's ventilation and warming, which just instructs that to keep the patient's room warm and ventilated just to keep them comfortable and yeah. Health of Houses has five essentials, which are pure air, pure water, efficient drainage, cleanliness, and light. So just five things that you would want to have in their room. Petty management is continuous care of patient while nurse is out of sight. This just means like whenever the nurse leaves, like gets off, or whenever they're not in the room, the other nurses or assistant type people who are going in and out of the room just to keep these same 13 canons while the patient's real nurse is out of sight. Noise in general to a minimum, but avoid anything stunning. So don't like scare the patient, and also just always keep it to a minimum because there's different things that you're having to hear, like with the patient, like their breathing, um, heart rate, just things like that. Variety helps to avoid sadness, just keeping different things in their room that they can do so that they don't get bored of always just sitting in their room doing nothing because some people are in the hospital for a very long time. And taking food, amount of substance that patients eat and drink. That's just something that we always have to keep track of because we don't want to overfeed them or underfeed them. Um, and I think all six of these theories are pretty continuous, like with today, things that we do in today's world. I feel like pretty much all of these are still kept the same. So, yeah. Okay, next slide. How do I? Yep.
Okay, so these are the next 7 theories of her 13 theories. So, what food, including patient food preferences? So, sometimes, especially when it comes to, the elderly patients, they won't eat or they refuse to eat. They're a lot more picky about what they're eating and they need food to, heal and continue growing. So, including like what they like or what they enjoy when it comes to like texture or even taste, like that's really important. Bed and bedding include comfort measures related to keeping the bed dry and wrinkle free. Okay, so wrinkle free is a big thing in nursing school because when the bed does have wrinkles, it can cause like friction within the skin, and that's a concern when it comes to skin integrity. And we never want that because we don't want to cause problems that weren't there to begin with. And then dry also comes with like infection or like bed sores. Like we need a dry environment so it's not moist and like causing the skin to get soft and increase chance for infection. So bed and bedding. Light, adequate light in the patient's room. Personally, I feel like a dark room can just be a little sad at times, but keeping adequate light in the patient room, I just encourages like you need the sun for like your skin and stuff like that. And I think that adequate light in the patient's room not only helps them to be able to see where they're going, see where they're at, but it also just keeps the morale high. Cleanliness of rooms and walls, keeping the environment clean. This is important, especially when it comes to mobility, because if there's clutter in the room, it will be a lot easier for the patient to trip or fall, and we never want that. So, keeping the room clean and the walkway clean and the lights on helps for mobility and to prevent from falls because that is a really important thing in the hospital. Personal cleanliness, keeping the patient clean and dry. This goes with basic hygiene, but also preventing further illness, because if you have dirt that can build up, also causes infection. We just don't want that. We want the patient to be clean, dry, and just in their best care that they can be. Trying hopes and advices. The avoidance of talking without reason or giving advice that is without fact. This is a huge thing for nurses and any health professional because, for example, if we say, yeah, you should be okay, and then something happens to where they're not okay, that's going to come back on us and their family's not going to be happy because their nurse told them that their loved one was going to be okay and they ended up not being okay. So we just want to try avoiding saying things that aren't factual and without fact behind it, because that can be misleading to not only the patient but the family. Observation of the sick, making observations and documenting observations. This is just charting, noting down what you see, noting what you don't see. This is also very much fact based because, you know, has a bruise on the arm, or I think that he tripped and fell and that's where he got that bruise from. Like, there's a big difference from that. And we just want to document exactly what we see regarding the patient and their healthcare. I think a lot of these are still very much included in nursing today. Like, we learn about these in nursing school. And so I think these points really do carry on through the years, and she knew what she was talking about.
All right, in conclusion, her theory is not so different from how we view nursing today. We still primarily focus on the patient, with the nurse manipulating the environment to enhance patient recovery. Nightingale believed nursing was a calling that not everyone was meant to accept. She believed that nurses were to be holistic individuals with spiritual dimensions. Nurses should be involved in promotion and teaching good health to all, regardless of if they were sick or well. So she was like the pioneer of her time, and her name lives on through her School of Nursing and Midwifery. And these are our references, which is just our book. All right.
Um, so now just end the recording.
Bye.
Peace.